My name is Dr. Devin Radford. I'm one of the clinicians here at Tampa Bay Functional Neurology. Here at Tampa Bay Functional Neurology, we apply innovative care to persistent neurologic injuries. So the majority of our patients are not coming to us farm fresh, so to speak. They have seen 3, 4, sometimes 9 or 10 other doctors prior to coming to us. If you have a complex case or a problem child style of case, it's very likely that we might have something that we are able to offer you in the way of more answers, a path forward, and what prognosis looks like, whether we can get you better as far as moving forward down the line. Our fix for that, and the thing that we hang our hat on the most, is that in one visit, we will be able to realistically tell you whether or not you are able to benefit from the type of treatment that we offer here. Our one visit is a 90 to 120 minute long comprehensive examination. We desire to know all of our patients well. What we mean by that is we take 30 to 40 minutes of that initial consultation and we run 120 to 150 specific questions that matter relative to your condition. After that, that augments your answers to those questions that we have, augment the physical exam that we perform after the fact. And so everything that we do here at Tampa Bay Functional Neurology, we strive to make personal to the condition. We have many patients that have come to us dissatisfied with previous experiences with doctors. They've had rushed exams, they have felt unheard when it comes to expressing what it is that they are dealing with. And they're frustrated because they have not been given either time of day or a full problem-solving approach to their case. Those are the things that we strive to make forefront here at TBFN because our patients, we feel, deserve that. So, what's our process? The majority of our patients find us either by word of mouth, internal referral, or by finding us online through Google, through any means of looking through maps. They find us online. At the point that you've found yourself here on our website, one of two things normally happens. Either we directly call into the office and you'll communicate with someone from our team in order to book and schedule your consultation. Or if you are not totally certain that our services are the next best step for you, the thing that would be smartest, we offer a 15-minute discovery call so that you can speak with one of us or our patient care coordinator who can give you the next level of details as to whether or not our services would be appropriate. After one of those two things, we move forward with a new patient exam. The new patient exam is a 90-minute to 2-hour endeavor, and in that single visit, we will be able to realistically tell you whether or not we can help you. If we can, we'll be forthright with you about that. We'll talk about what a treatment plan looks like. If you're not, and you are not the best candidate for what it is that we offer here, we'll be forthright with you about that too, because we want our patients to get a realistic expectation on their investment, their time, their money, their resources. TBFN values those things, and our physicians strive to value those things as well alongside our patients. So we strive to know our patients well, and if there is something that we can do for you, or if we have seen your condition before, we want to move forward with being able to help you in a way that makes sense and is expedient. Treatment at Tampa Bay Functional Neurology looks individual on an individual case. So each patient is doing something mildly different than maybe the next patient before or after. We do that on purpose. There is nothing standard or cookie cutter about our processes here, but we can talk at least generally about what it looks like. The majority of our patients are coming to us with some form of neurologic dysfunction, whether it's head pain, a brain injury, chronic nerve pain, the gamut of neurologic conditions. Inside of that, there are a handful of commonalities. The centerpiece of treatment at Tampa Bay Functional Neurology is always some form of neurologic rehabilitation. So if there is something that is going wrong in the way that the brain functions, or a specific neural network or system is trying and failing to do its job throughout the day, we have to apply therapy to it. Normally that looks like progressive resistance or progressive fixing of the structure that's failing. So let's make this specific. Let's say you're dealing with balance issues, or let's say you're dealing with dizziness. We would do our exam and we would identify which specific balance apparatus in your body is failing. We would then apply therapy to that. So let's say that it's your eyes. Let's say that the eyes have 6 categories of movement. Let's say 4 of them are intact, 2 of them are impaired. We have to apply therapy to those 2 specific mechanisms of the eyes. Let's say it's convergence divergence, or it's smooth pursuits, one side versus the other. If they're not working, you're not going to feel balanced. And so the specific fix in that case scenario has to be neurologic rehabilitation applied to two mechanisms that aren't working. Alongside neurologic rehab, we have a handful of different styles of modalities and passive therapies for each individual case that we tailor make into a curriculum for each patient that help with either pain management or dysfunction management along the way. So you can find more of those things on our website, or if you give us a call, we'll be happy to talk to you about the full spectrum of curricula that we have as far as treatment modalities. A question that we field here pretty often at Tampa Bay Functional Neurology is, what makes us different? What is it about our approach or the way that we do things that might cue patients to come and consult with us and seek care here as opposed to anywhere else? Valid question. Our answer to that, let's take an eye exam. You might have gone to your doctor and let's say you have a visual complaint, or you're dealing with dizziness, or you're dealing with chronic headaches, or you've had a brain injury, and amongst other things that you were dealing with, you feel as if there's a visual component to your case. Something about your eyes is off. You might have had them do the basic pattern, field of gaze, up, down, left, right, ins and outs, 20 or 30 seconds. They might even have done a VNG or some other additional testing for you and told you, okay, you're normal. There's no issue here as far as what's going on. Your vision is fine. You know that your vision is not fine because you are dealing with symptoms that feel visually oriented, at least in part, on a day-to-day basis. Here's where we transition to what we do differently here at Tampa Bay Functional Neurology. Instead of a brief casual exam, we are in depth, we are looking for details, and we are finding things that other specialties might miss. So for instance, let's run the same pattern back. If we move eyes left and right, and we're tracking left and right, say you can move them once, backwards and forwards. But what happens at rep 10, rep 12? What happens with convergence divergence if we prompt it over and over? If we don't have any dizziness at step 1, but we have dizziness at rep 4 or 5, okay, that tells us something about the disposition of how the brain accomplishes this task. When we're looking at how the eyes move, are they skipping at all? Are they moving up and down properly? Are we failing to hold vision on targets? You have to take time to look at these things, but you can only find what you are looking for. So if you're not looking at the details here, you're going to miss the details. Those details make all the difference in the world when it comes to finding root cause reasons for why things are happening. We apply that approach not just to vision, but to the holistic scope of how the nervous system is supposed to work on a day-to-day basis. And it's because of that and our willingness to take the time required to know our patients well and to diagnose them thoroughly that we are able to find the root cause reasons why there is dysfunction in the first place. So if you're watching this video, odds are you are looking for something nervous system adjacent. You're likely dealing with symptoms, or you know someone who is. At minimum, the best next step is going to be getting a quality examination done. We will be forthright with you. If you come in or you have a loved one come in, you have your exam done, if there is a realistic return on investment for your time and your money. We are not interested in applying care to cases that don't need us, or if we're not the right fit. We want to make sure that if we can help you, it's specific. All the details that we've discussed here, all the details of your case matter, and we desire to know you well. And if the fit's right, a treatment plan with Tampa Bay Functional Neurology might be your next step to finally getting answers, or to going back to feeling the way that you did previously. So the next step towards a more whole and well-centered life.